Good morning, good afternoon, and good evening, everybody. Welcome to today's Grand Bargain Cash Workstream subgroup webinar, which today is going to focus on linking humanitarian cash and social protection in response to the COVID-19 pandemic, and highlighting the successes and the challenges in ensuring inclusive responses. My name is Lois Austin. I work with the Grand Bargain Cash subgroup on linking humanitarian cash and social protection. And we're going to start the webinar today with our usual poll to try and give us an idea of who is joining us and who's going to participate. And this will help our speakers, the experts that we have, know how to tailor some of their interventions and their responses. So please select now if you are a humanitarian actor, a social protection actor, neither of these, or both of these. And we will let the poll run for a few seconds. I'll count it down to closure from 5, 4, 3, 2, 1. And hopefully in a minute, we will be able to see what the results of the poll are. So we've got 39% of participants are humanitarian actors and 37% social protection. 15% cover both, and we've got 10% who are neither, don't fit into either of these brackets. So thank you very much. That will help our experts to understand who is listening in and who might be sending in questions. So just before we get into the substance of the webinar, just a little bit of background on today's discussion and on the subgroup. So the subgroup is co-led by UNICEF, the IFRC, and by DFID. And part of the work of the subgroup is to reinforce dialogue between humanitarian and development stakeholders, particularly on links between humanitarian cash and social protection, and specifically in recent months on COVID-19 interventions. This area of work is led by UNICEF and it's funded by DFID. In addition to webinars like this, we are trying to boost knowledge sharing and learning between the different stakeholder groups. And so we also have a weekly newsletter, and we have a live and editable mapping document which is trying to map those countries where there are links between these two different types of assistance. And you should see the links to both of these in the chat box. So please do contribute to the mapping. You can go in and edit it yourself and make additions yourself, or contact me if you have contributions for the newsletter. We're also in the process of developing a series of case studies around where links have been made between humanitarian cash and social protection. So please do contact me on my email address, which should also be in the chat box, if you have any contributions. We're also linked to socialprotection.org's COVID series of webinars and events, and we would really encourage you to attend their upcoming Global E-Conference, which is entitled Turning the COVID-19 Crisis into an Opportunity, What's Next for Social Protection. This is going to take place next month, so on the 5th, 6th and 8th of October. And the event is going to provide space for evaluation and experience sharing, as well as learning about social protection responses to the pandemic. And it'll provide the opportunity for discussions on the future of social protection in post-pandemic scenarios. And you can find more about the event there on the screen in front of you. Today, we are going to hear from experts coming from 4 different countries, from Somalia, the occupied Palestinian territories, the Philippines and Syria, and they're going to highlight how humanitarian actors and government social protection systems have worked together to try and avoid exclusion and ensure inclusion in linking humanitarian cash and social protection interventions during the COVID-19 pandemic. I'm going to hand over to Andrew Patterson, who is the Knowledge Management and Learning Specialist for CARE USA. Andrew's going to facilitate the discussion between these experts, and he will introduce them to you now. So I'll hand over to you, Andrew. Thank you all very much.
Great. Thanks so much, Lois, and nice to be with all of you today. As Lois said, I will introduce the participants shortly, and they will then give each about a 3 to 5 minute presentation on what their field of expertise is. But later we will have a discussion. So as they're speaking and as I'm introducing them, I would encourage you to note down questions and think about the types of questions that you might want to ask each one of them. So I'm going to start by introducing Amy Santos. She is the Gender and Gender-Based Violence National Program Officer with the United Nations Population Fund in the Philippines. She's a longtime advocate, community organizer, and public health practitioner addressing gender justice issues, specifically issues of reproductive health and rights and gender-based violence in development and humanitarian context. Welcome, Amy. Next, we have Guhad Aden, who is an independent consultant, and he has been working in different regions of Somalia since the early 1990s. And he has long-term experience in humanitarian and development programming. Since 2012, Guhad has been engaged in humanitarian development studies and consultancies, including with Tufts University in the Horn of Africa. Currently, he is a key expert consultant on the facilitation of social transfer in Somalia, and he's supporting the Somali government in development planning. So big welcome to you, Guhad. Hala Darvish is the UNICEF Social Policy Officer in Syria. Hala has over 12 years of hands-on experience responding to humanitarian crisis in Syria within the UNICEF system. Hala was appointed as the Social Policy Officer in 2016 and is responsible for the implementation of cash transfer programs in Syria. Thanks, Hala, for joining us. And finally, I would like to introduce Najla Shawa, who is the Food Security and Vulnerable Livelihoods Manager for Oxfam in Gaza and the occupied Palestinian territory. She's managed several humanitarian projects involving cash and vouchers, and she is a wonderful expert. So Najla, thank you for joining us and welcome. As I mentioned, we will be having a discussion with questions and answers. So I'm going to turn over the microphone to each panelist to give us a brief overview, but please remember to think about the questions that you might like to answer. So first I'll pass it over to Amy, and Amy, after you're done, Guhad, you can go, and after Guhad, you're done, it's Hala, and after you, Najla. Over to you, Amy.
Thank you, Andrew, and happy Thursday to everyone. I hope you're well and safe. The UNFPA Philippines focuses its direct service projects in the southernmost island of the Philippine archipelago. And it's a region that's predominantly Muslim-led and has been engaged in a protracted armed conflict for the last 30 years. So these are communities that are caught in cycles of armed conflict, disaster, and displacement. And before the COVID-19 pandemic, UNFPA Philippines was implementing numerous projects in these hotspots, addressing sexual reproductive health and rights, as well as GBV cases, primarily establishing women-friendly spaces, and then capacitating internally displaced women to become WFS facilitators, as well as GBV monitors. And this was our Cash for Work program. Last year, the Bangsamoro people pushed for regional sovereignty, and they established a Bangsamoro Autonomous Region of Muslim Mindanao. It's a very young government, and they're beset with many issues of resources, limited capacities, erupting armed tensions, and competing leadership. So in this region that we focus on, we are working with communities that have multiple and intersecting vulnerabilities that are shaped by their status as a religious minority, as a displaced population, and poverty. And we support their recovery and their resilience by implementing several cash assistance programs, Cash for Work, Cash for Health, which incentivizes pregnant lactating women so that they can go for prenatal checkups and postpartum care. And then Cash for Protection, which are unconditional cash grants that we give to GBV survivors and people with severe psychosocial issues and needs. And our big success in the last quarter, we were able to support 3,500 women throughout these various programs, again, kind of providing them cash assistance so that they can strengthen their capacities during a very challenging and difficult and unprecedented time. Our challenges, of course, are probably similar to everyone throughout the world. The mobility issues are particularly exacerbated among internally displaced women and have curtailed their freedoms and their ability to cope and survive and address their own issues. We spoke in an assessment that we did with women across many vulnerable communities, an internally displaced woman who said that she would rather be in the armed conflict. She would rather be in the Marawi siege that beset her community rather than be in this pandemic because of the ways that it has paralyzed herself and her community. So I think I'm looking forward to the discussion today and really looking forward to learning from the wisdom of our colleagues. Good morning, everyone.
Thank you so much. Guhad, over to you.
Hi, good afternoon and good morning, everyone. My name is Guhad Mohammed, has just been introduced. And Somalia as a country is a country that has been affected by 3 decades of conflicts, violence, cyclical climatic-related crisis, which led to unprecedented internal and external displacements. The Somali government developed the country's first social protection policy and framework in 2019. It is a significant milestone for a country affected by decades of conflict, violence, and cyclical shocks. The policy envisions strengthening all components of social protection system, including linking with the development of a single registry and the long-awaited ID card system. It advocates for beginning with the transitional safety nets, then transitioning to social protection floors. An objective of the policy is to progressively expand social protection, expand access to social assistance, especially cash-based social transfers that support poor, vulnerable people, including children, the disabled, the elderly, to improve their standard of living in line with the minimum social protection floors, invest in their future and those of their families, and build resilience to shocks. The policy recognizes that there will be a need for a cash plus interventions in order to address nutrition, health, and education outcomes. Humanitarian cash transfer programming at a scale in Somalia is common, and local and international remittance systems are also extremely strong. Agencies and organizations that are currently involved in delivering humanitarian assistances and resilience programs, including cash transfer programs, and their associated systems and progress, expertise, and coordination mechanisms will be vital in supporting the implementation of a cohesive national social protection programs in Somalia. The government aims to build on humanitarian registration systems, but we are not sure when these systems will be available to humanitarian actors for use. There is no single recipient registry system in Somalia at the moment that humanitarian agencies can use. The government aims to build a unified registry, but equally, we are not sure when this will be again available to humanitarian actors. In Somalia, the risk of being excluded from humanitarian cash and or social protection approaches can be linked to locations, especially where you are, particularly within the country, or who you are, clan dynamics and group identities, as well as political affiliations. Vulnerability in Somalia is seen with different lenses, or is viewed through different humanitarian lenses. For example, the susceptibility to hazards, or social protection lenses, which looks at the form of vulnerability without a need to justify assistance based on susceptibility to hazards. There is potential for linking the new social protection with humanitarian cash voucher assistance to ensure inclusion in a number of areas, including targeting criteria, registration, delivery systems. those at risk of exclusion in Somalia are basically those who are from the lesser clans. When I say lesser clans, I mean those who are coming from the minorities. The challenges of working in a country where there is no functional social protection system, or the social protection system is just scrolling now, where and how humanitarian actors mean to make linkages with it suggested is as a theoretical framework rather than being practical. Having you on board today, we will be interested to learn from you and see how much we learn from you and incorporate what we learn from you into Somalia social protection programming. And thank you all.
Thank you so very much, Buhad. We appreciate that. Hala, over to you.
Thank you very much, everyone, and hello. Hello, nice to hear from you and see you all. I'm just starting with the introduction about the context of Syria. As you may all know, Syria has been under the humanitarian crisis since 2011 for over around 10 years. And where we have the national social protection system has failed to respond to the increased needs of the population during the crisis. This is, of course, as a result of the budget constraints as well as fragmentation and insufficiency. So UNICEF, building on the pre-crisis national cash transfer program for people with disability, which was owned and the government was using, we introduced the innovative, for Syria, of course, the innovative cash transfer program for children with disabilities, children with severe disabilities, which is targeting children with severe intellectual disabilities. And it is innovative because it is combining the integrated social protection scheme that combines cash transfers to families of children with disabilities, addressing the economic vulnerabilities, and the case management services that addresses the social vulnerabilities. So both for the demand side and the supply side barriers. So building on this national scheme, we were able to set the criteria in collaboration with the Ministry of Social Affairs and Labor. We managed to set clear mechanisms on the implementation of this program. We set the criteria based on the Syrian National Classification for Disabilities, which was also helping us to be able to build on the existing registry database of the ministry to be able to get the data for our beneficiaries. Of course, the cash transfer is unconditional. It's about for 1 year of bi-monthly cash transfer for 1 year. And it targeted up till now, since it was launched in 2016, it targeted around 24,000 children with disabilities and their families. Main success of this program is the collaboration we had, the successful collaboration we have with our counterpart, the ministry, the case management component, which has linkages to the available public services, though interrupted, but at least the case managers are trying to do their best to link our beneficiaries to the available public or private services. As well as the updating the registry, the database of the ministry, as everyone in Syria with disability should obtain a disability card. So based on our screening and verification, we were able to refer our beneficiaries to obtain a disability card if not having, and to renew the conditions of this type of disability in case they have already one. One of the main successes as well for this program is our good collaboration we have with our financial service providers, the available one. They were able to meet our requirements, though we have this security situation, we have this economic situation that's prevailing all over the country. We have this somehow economic hardship that is faced by everybody. So this was one of the major successes we have. We have also managed to adjust our program as a response to COVID-19 by combining the rounds to make a better value after the depreciation of the local currency compared to the US dollar. We also managed to do remote case management when the field work was not feasible. This was also great for us. We have the constraints related to the implementation are related to mainly to the access. Not all governorates are accessible. So this prevented us from reaching all children with this, that are in need, as well as the lack of the financial service provider. The banking system is not that strong in terms of coverage and in terms of liquidity. So we had this constraint as well implementing the program. It is also important to know that during the implementation we did 2 PDMs in 4 governorates, post-distribution monitoring reports, to measure the impact of this cash transfer program on our beneficiaries. And it was noted that we have a very high rate of decrease of school dropout of 68% after the cash transfer, which is a really great impact for our children. We have a decrease in negative coping strategies among beneficiaries compared to before the program. So 64% no longer needed to cut on the essential healthcare, and 30% didn't longer have to compromise food intake and spending on education as well. We also noted that there is an increase in the use of public specialized services compared to the public services because of the increase of their cash intake. Over to you.
Great, thank you so much, Hala. Very interesting. Najla, over to you.
Yes, hi. Good afternoon, everyone. So I'm based in Gaza, and I'm going to speak maybe more specifically about Gaza, but just to give you a general context of the OPT in general. The general context is, of course, extremely political, just as many other countries regarding the Gaza Strip and the West Bank. Political constraints have been really shaping the story of Palestinians, and specifically in the Gaza Strip, you'd say that living under blockade for about 15 years is really making the story becoming more complicated year after year. Now, when it comes to the social protection outlook, first of all, there is you can say that there's a very generally weak capacity at the government level to really address social protection in its real essence, I would say. The situation between, for example, Gaza and the West Bank is also problematic regarding the politics and the governance systems, as they are split due to the political division. So this adds another layer. You have also a lot of presence from national non-governmental organizations who have been active in Palestine for decades, and also the donor community and international NGOs have been also actively engaging in this humanitarian protracted crisis. So really by explaining how protracted crisis means and how cash programming in general fits to support humanitarian response, it becomes kind of blurry when you want to address social protection in this very particular context. For example, the weak capacity at the government, the low capacity also to coordinate between what is formally considered social protection and what is informal makes it also more complicated and challenging. What NGOs like Oxfam and others are continuously trying to do is kind of sometimes working towards a humanitarian response that is linked with this bigger picture. But due to the really the big gaps within the system to, for example, include very critical vulnerable groups such as women or GBV, persons with disability, orphans, etc. Each of these groups has its story and has the level of support provided to them that is unfortunately limited or minimal when it comes to a coordinated and well articulated response. So for example, a lot of the services handled to these groups are done solely by NGOs or NGOs and not by the government. However, the Ministry of Social Development that is responsible for the major program that deals with social protection is the program that is known the Palestinian National Cash Transfer Program, which is a 4-time-a-year cash transfer that is provided to about 80,000 families in the Gaza Strip. And it's been, in the past 2 years, it's been suffering from delays. So instead of receiving every 3 months as it is supposed to, families are receiving three payments a year. So due to these delays, when a crisis such as COVID comes up for Gaza, it's just one of these stressors or shocks. Because as many of you know, the Gaza Strip has been subject to recurrent crises in between this humanitarian crisis, such as the conflict that is ongoing and the continuous and persistent impact of the blockade that is really not allowing any economic activity to be at all viable or sustainable. So what makes Oxfam's job really difficult is that it has to, and it is working on different levels. So one is the overall kind of the policy and influencing level that we try our best to influence from the outside, the external community, of course, to pressure Israel. But I mean, talking about the inside now, also influencing the government and working towards more coherent systems and more coherent ways to really work and address these issues. So just to give you some examples on our projects that we try to address and to be inclusive in our work, is that we do cash programs that are what we are calling now the cash for protections for families who might be receiving a cash transfer from the government, but it really, I mean, even when you compare to what they need, it just covers hardly 50.
Hello, I think maybe Najla's video cut out. Hopefully you can see me and hear me though. Thank you so much, all of you, for those really interesting backgrounds about what you do. It's amazing to think about how inclusive you are in different ways. As you heard me say at the beginning, we are going to focus on questions and answers and discussions. And as you see, some people are already using the Q&A, question and answer, chat box at the bottom of the screen to type in their questions and answers. So thank you so much for everybody who did that. And we encourage you to type in as many questions as you would like, and we will try to answer them all. If we are unable to answer them, we will prepare a written document, and that will be shared with this audience and will be published with the webinar summary, which will also be available on socialprotection.org some days after the webinar. So if you are able to ask questions with your name and organization, that would be great. And I think that Zara gave us a great first question, and I'm going to direct that question to Guhad. So Zara said from UNICEF MENA, great presentations and thanks to the panelists for this. I'd be interested to hear more on how preparedness played a part in being able to roll out programs. It's something we talk about a lot, and a deeper dive into the issue and the challenges and any tips would be great. So Guhad, what are the key factors of preparedness, both technical and other enabling ones, that you view as important? Thank you so much. Guhad, are you there?
Yes, I'm there. Thank you very much. And just to try to answer that question, I think one of the most important things is to make sure that you are in line and following the country system. For example, the humanitarian response plan system, the social protection system for the case of Somalia, and which I assume many countries have their social protection policies and systems much advanced than Somalia. And for the case of Somalia, for example, the social protection policies provides or has provision for vertical and horizontal scale up in terms of when there is a, when trying to scale up to the social protection or the social transfers that has been there has to be linked to crisis responses or shock responses by doing a kind of horizontal and vertical scale-ups in terms of shock response. There are several pilot shock responsive pilot projects that are going in the country, and a lot are being learned from them. And there is an initiative that has been initiated by the CASH Working Group, and where they have engaged some consultants to do a study on the learning aspect of the CASH responsive pilots. And to add on that one, on that one, in terms of preparedness, is monitoring the early warning indicators of the country and indicators to trigger shock responsiveness, and then scale ups. The other important factor is trying to see how much the local humanitarian or national humanitarian response system is localized. Of course, local respondents are much more easy, have much more access in terms of monitoring the indicators for triggers, and then how much are local actors being involved in terms of monitoring the indicators is critically important. Over to you.
Great. Thank you so much, Guhad. That's interesting. So if the panelists want to be on video, that would be great to help people think about who you are and kind of capture in their mind who is on video. So we have another great question from Rawia Altawil in UNICEF Yemen. For Hala. So Hala, you can see it in the box, I think, but she says, considering the civil war in Syria and increasing poverty, how does the cash transfer program targeting limited number of families select those most in need? Also, question to everyone, but maybe Hala, you can address this. How do you deal with social tension resulting of limited reach of such programs? Thank you.
Thank you, Andrew, and thank you, Rawia, for the question. Actually, we managed to when we did our planning jointly with the ministry, we managed to set a clear criteria for our selection. So we ensure that this criteria is well communicated with everyone, including our IP, who are trained. All IPs on the ground are trained on our program mechanisms and the way we implement our program. The steps we do it, it is well communicated with through communication messages. So when we target this location, we have our communication messages that have all the information about why those are eligible, how did we select them, based on what, the duration of the transfer, and everything that is related to the program implementation. To ensure when we have this small set criteria, eligibility criteria, and to ensure that we don't even have a social tension among all beneficiaries and within this criteria, we ensured that I forgot what we ensured. Okay, we followed the sorry, we followed the humanitarian principle of equity, and we ensured that to ensure that no child is left behind. When we target any location, we reach all children with this falling under our eligibility criteria with the cash transfer. So we tried our best to ensure that we have all resources to cover all children falling under our eligibility criteria, which made this another success for our program. Thank you. Over to you.
Wow, thanks. That's very interesting, Hala. So Najla, welcome back. You cut out, but I think we got most of your presentation. So thanks for rejoining. Internet can always be a little bit of a challenge. But considering where you work and the fact that you might want to say a couple more closing words, it would be interesting if you can also address how you deal with social tension resulting of limited reach of programs. So over to you, Najla.
Yeah, thanks, and sorry about that, about the cut. Honestly, social tension in itself is not really one of the major concerns within the Palestinian community. It's more of the political one between some political factions, of course the ruling ones, and the political split. So this is really mainly the issue. So between Gaza and the West Bank, that tension is an issue as governments. So not between the community or society. I would say that there are things that help, and it's something that we organizations need to capitalize on, which is the informal support, the informal social protection systems that we should look into even more, because there is a lot of the notion of solidarity between people, and people still have a sense of community where they need to kind of get back together and support each other. And we are seeing that even coming back, even in the developed world, with the COVID crisis. So I think this is something worth looking into, and there are opportunities, and we are seeing good examples from that, from a crisis to another. So on the contrary, I think there are opportunity more than a challenge when it comes to the society and the social relations between people.
Thank you so much for that insight, Najla. Very interesting. So Joanna Springer from RTI International has a question for Guhad, which is, what were some of the factors, social, political, etc., that prepared and incentivized the Somali government to roll out a social transfer program? What are some of the challenges related to integrating humanitarian operated cash transfer programs with government operated programs? Thanks for that great question, Joanna, and over to you, Guhad.
Thank you very much, Joanna, for the question. And to start with the first part of the question, and the most important part of it, the most important one, for example, for the government, the Somali government to be prepared and incentivize the rollout of social transfer. And it is important to note that both the social protection policy, the Somali social protection policy, as well as the Somali social protection system itself are very young. And we all know that Somalia has been under has been affected by recurrent, has been a failed state for almost 30 years, or close to 30 years, and the systems are coming back slowly by slowly. And anything that is being done in the system, in trying to build the system or trying to contribute to the building blocks of social protection, as well as the social transfer systems, will help the system at the end of the day. What I want to say here is that the social protection system of the Somali government is now piloting several programs. There are some government-led social transfers that are being piloted in the country. A larger one, which is covering almost 220,000 households in 21 districts, is a World Bank supported program known as Bahnano. What the government is trying to do is to learn how government-led yet implemented by international actors be slowly rolled out into government system. And of course, that will take some time. It's not going to be overnight, because there are no systems there are no systems within the government. The expertise is not there. All the other building blocks are not there. And thanks to the World Bank, as much as they are funding the social transfer of the program, they are also funding the system building of the government, which, to my understanding, is at its very early stage. We anticipate these programs to develop, the government system to develop slowly, but eventually roll out to a government program. But of course, we don't see that one coming in the coming 4 or 5 years. And coming to the second part of the question is, I think she's asking, what are some of the challenges related to the integration of humanitarian operation, cash transfer? Okay. And the main challenge here is that the humanitarian practitioners or the cash transfer responders have been in Somalia for quite some time, doing in a very traditional way, out of government system, out of government regulated system. And the main challenge here now is that for the humanitarian actors to accept the government regulated system or go through the government system in terms of cash transfers. And that's a big challenge even for the government, for the government system to build in the future and roll out slowly. I hope I answered your question or not confused you more.
Yeah, I'd like to jump in here, also following on Gohad's note on the government. Actually, something similar can be taken from the context of Gaza, unfortunately being separated from as a governance system. I mean, in terms of how split the government is between Gaza and West Bank, sadly, is exactly that, is the no contact policy of most of the NGOs. And all the donors have led to that, had made this government working on its own, and we are somehow working in a parallel realm. So yeah, it's really hard, and I think it's much worth it to engage whenever possible with the government to try and really build jointly these systems. I just wanted also to touch upon a question that was raised earlier on preparedness. It's something that I think is extremely valuable also in our experience here, maybe due to the very prolonged humanitarian crisis, is that preparedness is so important in launching any response. Of course, it's obvious for the obvious reasons, but it needs to really take into account many elements and details. It starts from dealing with the community and having this connection with the community, with the local partners on the ground, their knowledge and their understanding, but also have actual systems and SOPs to really deal with the response practically and be able to adapt. And this is really now helping us in how to adapt to COVID. So how we're switching programs of, for example, our food vouchers and cash assistance, given the restrictions now, and how we are changing completely to a different mechanism. So preparedness is really key.
Yeah, it really is. Thank you so much for that. And that kind of connects to a question that I wanted to ask Amy to bring her back into the conversation. Amy, what approaches do you think humanitarian agencies can adopt to ensure that even when there's changes in political leadership, inclusive responses remain a priority when transitioning to longer-term social protection approaches?
Thank you, Andrew. The Philippines has actually benefited and enjoyed from decades of advocacy from feminist groups and advocates and champions for gender equality. And as different administrations turn towards more authoritarian complexions and the democratic space shrinks and the humanitarian corridor narrows a little bit, we have to rely on a lot of those trusted relationships with those champions and those feminists to kind of use different levers to hold duty bearers accountable and to hold them to those mandates and to those commitments. So as this current government has turned a little bit more militaristic in their approach and in their response to the COVID pandemic, we actually gathered and engaged 27 agencies across the different spectrum of humanitarian actors to conduct a gender and inclusion assessment and really reach out to the most vulnerable, the most marginalized communities. Because within the marginalized communities, of course, you have much more vulnerable groups. And having that data and that information, we were then able to use different levers to actually hold the duty bearers' feet to the fire. We use donors and asking them to actually use their accountability mechanisms to center, elevate, and use equity as a measure of success. So we presented the different ways that groups like LGBTQ folks, people with disabilities, indigenous folks, and displaced people are actually experiencing this pandemic in much more. Using those statistics and using those stories actually help galvanize a set of donors and a set of government agencies to now begin to use those measures as ways to look at their efforts and who they're reaching out to. As you can imagine, there's a lot of pressure right now to go online, to use remote modalities, but then that further includes so many communities who don't have signal, who don't have a specific indicator for the well-being of community. And it's also been extremely helpful for us to detail with a lot of information and data, the ways that households are being excluded. So groups that we're calling hidden households, the mechanisms, the very institutionalized ways that people are not being given public assistance, that they're being made ineligible for a range of reasons, primarily because they're not politically affiliated with local government officials. And then surfacing and elevating those stories. So we take advantage and we leverage, again, decades of activism that many women's organizations have built through the years to kind of pull different pressure levers and push duty bearers to continue serving different groups whose rights are already protected in our laws. You know, they've already been enshrined through different Magna Cartas, through different kinds of social protection systems. It's when the administration turns exclusionary and militaristic that we then have to use external pressure points to hold their feet to the fire.
Very interesting. Thank you so much for that, Amy. Hala, you have work that's related to the answer that Amy just gave, and there's also a couple questions for you in the chat box. One around requiring beneficiaries to present identity documents and if children have birth certificates, and another around are you giving out both cash and in-kind transfers in your program? And if you've noticed specific preferences for those, and what kinds of households might prefer which mechanism. So Hala, I'll let you answer those things.
Thank you very much. Just to add what Amy said, and just to mention that although our program, the Humanitarian Cash Transfer Program, is a relatively small scale program, but it has the focus on the most disadvantaged group of the children, which are children with disabilities. It presents a model of integrated and focused and child-focused social protection scheme. And the most important thing, it is an example of how humanitarian program can present a natural entry point for a longer term engagement with the government. It is also a window of advocacy with the government of Syria on the child-focused national social protection scheme, which we are now working on at the upstream level. We managed to introduce and develop the National Integrated Social Protection Management Information System, which is being rolled out to address the fragmentation among the government-run social protection schemes. We also managed to promote for the integrated social services, which is an example of joined social services. Also, we have introduced at the human resources component the social workforce initiative, which is to develop the capacity of the academic institutions in Syria to formally train and license social workers through our work partnership with academic institution in the region. This was really important for us to work through our humanitarian cash transfer program at the upstream policy level. Coming back to the question related to the requirement of the registration, we of course need the birth certificate of the children in order to note down the eligibility of the age, because as you know, UNICEF targets children 0 to 18. So it's imperative to have the birth certificate of the child because we need to ensure that they are under the age group of our eligibility of our targeted children. We also need to have the disability card if available to determine the type of disability of this child, if they are eligible to be enrolled in our program or not. And if this disability card is missing, we refer them to the available Directorate of Social Affairs in the governorate where they reside to facilitate their obtain the updated disability card. If this is not feasible due to any security reason or any barrier they might face, we might ask them to have a certified doctor, certified report from a certified doctor about the condition of the child for this type of disability. So this is, and of course, just to note that the cash transfer is handled by the caregiver. It's not handled by the child. So we have the information about the caregiver who is going to receive the cash, we don't hand it directly to the children. For the preference of in-kind to cash, we have both programs in our social policy section. We have the in-kind of providing winter kits, but to children, to all children, but the children 0 to 14 residing in remote areas where we cannot have access and we don't have, we have humanitarian situation like security situation, we have remote rural areas, hard to reach areas where we cannot have functional markets to spend the cash. So this is as part of the humanitarian support for the in-kind part. We have, from our result of the PDM, we noticed that our beneficiaries prefer to receive cash over in-kind because of the recent economic hardship we are living, because of the prolonged humanitarian crisis Syria went through. So after all agencies, humanitarian workers are used to provide in-kind supplies as emergency response. It's now time to consider other needs, economic need and social needs of the Syrian people, which is addressed by providing direct cash and unconditional, so they can decide themselves on how to use it and based on their needs. I hope this clarifies and it's sufficient.
Great, thanks so much for that, Hala. It certainly does seem to be a preference in many places to receive unconditional cash over in-kind transfers. That's true. So we are coming to the end of this presentation, but I want to give Gura just 1 or 2 minutes, if you can address the question from Hiba at CARE Canada, Guhad, about the experience. What is the role of humanitarian cash programming in supporting the setup of social protection policies in the Somalia context? And what are the key challenges and opportunities from your perspective? If you can answer that succinctly, I would appreciate that. Thanks.
Thank you very much. I think as said earlier, cash transfers can absolutely be the basis for social protection. Of course, when there were no social protection systems or social protection flows in the country before, then what happens is that we have to start with a specific or subsets of social protection flows. For example, the social safety nets. We start with if we use the humanitarian cash transfer as the basis of social safety net or safety net transfers, then that will obviously assist in supporting the government-led social protection system. This is already happening in Somalia. There are several programs of course, it's not large programs that are harmonized, but happening in different pockets. There is a consortium, a resilience building consortium known as BRICS. They are doing social safety nets. And of course, from the initial point, it was humanitarian cash transfer, but it has slowly transformed into a community-based the social transfer or social protection system, which sometimes it even has the elements of shock responsiveness in terms of when there's some crisis, they have scale-up transfers within the system. So there are several humanitarian cash transfer programs that within the country that are informing to be the basis of social transfer of the social protection system. Of course, this is something that is being brought together now. They are happening in different pockets and in pieces, and it is through the social protection policy that the government is trying to bring these different pieces together so that it forms the basis of the social protection of the country. In terms of the key challenges, I think I mentioned in the previous question that the very basic challenges are that most of the practitioners, for example, including maybe CARE or even others, who have been running programs of cash transfers without involving the government, maybe just involving the authorities at that particular place, be it a district or a community level, then trying to include the Somali national system, for example, starting from the federal government of Somalia to the federal member state, district, and then coming down to the community becomes a tedious process for them. And then maybe we tend to avoid this kind of long-term or long bureaucracy. So these are the challenges, but of course, Somalia is a country where we had a lot of challenges, and the things are coming back slowly by slowly. Of course, things are not happening again the way the humanitarian practitioners wanted them to happen in terms of security policies, pullers, and there are many teething problems even with the social protection policy. So these are some of the challenges that succumb the social protection implementation, but I see a very big light behind the tunnel.
Great. Guhad, thank you so much for closing us out with that question. Thank you to all of our speakers. All of you had such interesting things to say about how you are making this inclusive and how you are bridging the gap between cash and humanitarian and development programming and social protection. So thank you so much for your insight. There's a few questions that we were not able to get to, but we will follow up on those questions and we will send the answers to those to this group of people. I would like to ask you to please complete a feedback survey that will pop up on the browser, on your browser after the end of this webinar. It's brief and easy to use just to give us a sense of how this went. And also, please remember that the socialprotection.org team would like to invite you to their global e-conference, Turning the COVID-19 Crisis into an Opportunity, What's Next for Social Protection, and that takes place on the 5th, 6th, and 8th of October. So with that, I will once again say thank you very much to all of our great panelists, and thank you for joining us and taking time. I hope that you enjoyed conversation rather than PowerPoint presentations today. Goodbye, everybody.
Thank you. Goodbye.
Thank you. Bye all.
Goodbye.
Bye.
Thank you.